Being a physical therapist myself, I'm sure someone's going to come and help me get out of bed. A few hours passed, 6 hours passed, 8 hours passed. No one came. Everyone's coming, taking the baby, getting their, the necessary testing done for the baby. No one's coming for me. And I thought to myself, that's weird. Like,
Dr. Neha Pandya, thank you so much for joining me and really just being willing to speak about your birth experience and how it shaped you founding the recovery method. I want to go back a little bit. Am, I never considered myself truly a first generation American. My father's from the Dominican Republic, but that definitely did shape my experiences and how I navigated healthcare and also the education that we had as physical therapists. And I would love for you to share a memory that really shaped your approach or your your decision to create the recovery method and really pursue a change in maternal health care. What was that memory?
so first of all, thank you for having me. I'm really excited to have this conversation with you and share my story. The memory that comes to mind is immediately after giving birth to my son about 3.5 years ago. I remember not knowing what to do in that moment. I've always been a very strong, independent person, having that control of my life. And for the first time, I was vulnerable and in the working hands of other people. And I remember thinking to myself, okay, I got this far. How am I going to get up? How am I going to get better? And I thought to myself, oh my God, I have been reading so much about, being pregnant and how to take care of the baby. I don't know how I'm going to take care of myself. What do I do now? I remember having conversations with my mom. My parents are first immigrants from India, and I'm a firstborn generation Indian American. And I know that we've always talked about, education and work, but we've never really talked about health. And I never asked the question to my mom about what am I going to do for myself after the baby comes. And I know I asked her plenty of questions about what to do with the baby. I never asked anything about myself. And my mom never shared her story either. So I thought to myself, laying in that bed in the hospital, okay, I am going to ask the next person that comes in. I know a PTOT is going to come by. Being a physical therapist myself, I'm sure someone's going to come and help me get out of bed. A few hours passed, 6 hours passed, 8 hours passed. No one came. Everyone's coming, taking the baby, getting their, the necessary testing done for the baby. No one's coming for me. And I thought to myself, that's weird. Like, I remember working in the hospital shortly after I graduated PRN, and I never thought to myself, well, who was seeing these maternal mothers? And I asked the nurse and I said, hey, is someone going to come and help me get out of bed? And she's like, I can help you with that. And I said, okay, but can you like show me how to transfer, like protect my incision? And I remember in that moment, she and I worked so hard. I had to really recall my skill set about how I'm going to get myself out of bed. When you're in tremendous pain, all of your knowledge just goes out the window. And that's when it hit me that there needs to be something here for these moms to really educate them, try and help them get out of bed, try to help them really take care of themselves, try to really just be there as a support and let them know it's going to be okay. You're going to physically recover. You're going to get better. You're going to be able to take care of your baby. And we're going to help you with that. And here is the roadmap to do that. And I thought to myself, you know what? After I start recovering, when I'm home, I'm going to start really digging and just researching on this topic. And when I started, I didn't find anything. And that's when I was like, okay, I think that we need to start doing something and I have to take action. And that's when I started doing a lot of the research for the recovery method and finally thought, you know what? Let's get it out there. Let's get the name. Let me start finding, and networking with people that are like-minded and doing this amazing work like yourself.
I want to take a bird's eye view of this because I was also an acute care therapist for a very short period in terms of like my career. I was mostly outpatient women's health, pelvic health. And something happened a year ago, June of 2023, that just even changed my mindset about the work that we were doing to bring that help to mothers because we knew most maternity hospitals were actually baby centered in terms of their care. And there's nothing wrong with that. It's just that when you have a baby-centered care model, you do often forget about the needs of the mom, especially if it's after a cesarean section, right? And when we think of a cesarean section, we think of still under birth. We don't put it under major abdominal surgery,
Mm-hmm.
where that care would be offered on other units. And so something happened last year, which it involved my father, who's again always been independent in terms of like medicine, never wants to take it, doesn't go to the doctor for anything unless it's like truly an emergency. And while I was actually speaking on this very topic on the acute care panel, it was a kind of a webinar we were doing for the American Physical Therapy Association. He was being rushed to the emergency room for an obstructed colon. And about 5 days later, we found out he had stage 4 colon cancer.
Oh my gosh.
And the moment that I think I saw his true breaking point was just the agony of just trying to get out of bed
Yeah.
and the trapeze that hung over his head. Any acute care therapist would cringe about that force of pulling after not a major abdominal surgery. He didn't
Yeah.
have a cesarean section. He had robotic small incisions all around his abdomen that still were incredibly agonizing.
Mm-hmm.
And at that point, I was thinking of all this work I'm doing in maternal health and women's health after post-cesarean section, cesarean hysterectomy, all of that. Dr. Pandya, when I think about the frustration that he had and the advocacy that I had to have, even as a physical therapist, all of that went out the window. I was his daughter. He
Mm-hmm.
was now a patient. And we couldn't get a physical therapist in the room after 4 requests. The fifth request, they finally brought someone who helped and showed him the log roll. Because yes, could I have done it? Absolutely. Did I try? Absolutely. Still a
Yeah.
daughter of an immigrant. Like, there's a difference there,
There
right?
is.
For anyone who just knows. And